We're doing long-term positioning in a wheelchair. After you speak to your CI, you'll go to your patient and introduce yourself.
Hi, I'm Natalie. I'm your student physical therapist assistant. How are you? Good. Well, what I'm going to be doing, I'm going to try to make sure that you're more comfortable and that you're aligned in your chair. Okay? Okay. I'm going to start by locking your wheelchair. Adjust your feet. Make them a little more comfortable. Okay.
You want to make sure that the pelvis is aligned so the weight is even on the ischial tuberosities. If the patient leans more to one side, place a rolled towel against hip on the opposite side of the lean. You can also use a pillow. And you'll also want to make sure you put a pillow on the other side to prevent the patient from going the other way.
Okay. Can I get you to scoot back in your chair just a little bit? Okay, great.
The reason for this is to align the hips to balance with the trunk. This is also to prevent increased pressure on one side, and as the trunk moves to one side, the pelvis moves to the opposite side. Remember that pelvic alignment affects positioning of the entire body. After that, you add pillows or towel rolls between armrests and lateral side if needed. That's to facilitate trunk stability and alignment. Place flat towel roll in the back to support lumbar lordosis, to promote upright trunk posture, and to decrease pressure on the spine of the scapula. After that, you'll want to make sure that the feet are flat on the foot plates with supports with books or towels. Make sure that the femur is straight and that the position of the ankle is neutral. This is to prevent plantar flexure contractures. After that, you'll place pillows on the calf plates and behind the knee. This is to decrease pressure on the gastroc and to decrease pressure and stress on the knee. You can also use towels if needed. After that, you'll check the pressure under the thigh and adjust foot plates or books as necessary. This is to allow adequate space to decrease pressure on the sciatic nerve. Remember, do not allow so much space that the pressure on the ischial tuberosities or sacrum is increased. After that, you place a pillow between the knees. This is to decrease hip adduction and internal rotation, and also to decrease pressure on the medial epicondyles of the femur. After that, you'll place pillows under the axilla, forearm, and hands to level shoulders and position arms forward. This is to support shoulder joint and to prevent strain. This is also to prevent shoulder adduction and scapular retraction, to prevent dependent edema, and place them in a functional position. After that, you make sure that the hand is placed in a towel roll. This is to support wrist in a slight extension and to allow slight MCP flexion and to have a functional hand position. Make sure when you're placing the towel roll that you're putting the thumb at the end of the towel roll and no edges are touching the patient. Make sure the patient is properly adjusted after this, and that completes long-term positioning in a wheelchair.